Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hello, everyone. Hello, everyone. I'm excited again this week because I've got some great information. We're going to be talking about sensorineural hearing loss. If you know from last week and you've been following it, and I just want to say thank you to my listeners of Body in Balance, because we are killing it. I thank God for your loyalty, faithfulness, getting on, learning, because I love doing this. I love educating people on what's going on. God gave me the gift of teaching, and it's not only as a Sunday school teacher. For those of you that don't know, I am part of the Church of God in Christ, and so I have been a Sunday school teacher for years. And now I get the opportunity, and I've been doing medicine for 20 something years. So I get to do what I absolutely love, and that is teach medicine and how God developed and formed our bodies and putting out information that is helpful for you. It's the things that doctors, providers don't have the time to fill you in on. And now I have the time to be able to do this, and have found this medium. I'm on YouTube with Body in Balance, which you're probably watching it through that medium. We upload it to Facebook, and there's a Facebook Body in Balance page. I need you to lickety split, get on the Facebook page and help. Let's blow this up so that more people can be involved, more people can get answers to questions that they may have had. And we're going to have some awesome guests. I'm excited to tell you that we are going to have an audiologist who is going to come on, not next week, because next week I'm going to be out of town at a major convention with my church in Phoenix, Arizona. Yes, we'll be there, and I'm going to do a session, and it's going to be on tinnitus, or the ringing in the ear. I know some of you have had that. Some of you may still have it, but we're going to talk about it because it is associated with sensorineural hearing loss. I'm going to do like a quick 10-15 minute video just to talk about tinnitus. Then after that, the following week, we're going to have on an audiologist. I also have a guest that's going to come, and she is a colleague of mine who is a physician assistant, but her daughter experienced hearing loss, and she didn't know about it. And so I want you parents and you grandparents to get on board. We'll have a flyer out on the Facebook page. We'll put it out on the YouTube page. And I want to give a shout out to Brother Steve. Those of you that are in the Church of God in Christ, I know you know Brother Steve. And he has a streaming channel. That streaming channel is the church family channel, the church family channel. I am on the church family channel under church medicine, and you'll be able to see some of my videos there. Live stream, you can get it on YouTube, not YouTube, but Roku, Fire Stick, Apple. Any of those, you can get his streaming app and be able to find Body in Balance and the information that we have. So let's quickly get involved with what's going on for today. Today, we're going to be talking about basic understanding of sensorineural hearing loss. If you noticed last week, we talked about three different types of hearing loss, and that was conductive hearing loss. If you didn't see that, go back and look for my conductive hearing loss, I can't hear you video, and you will learn some things about conductive. It's different than sensorineural. And the third one is a mixture of both, because I'm talking about both of them in a thorough way. We're probably just going to talk about the two. Now, when the audiologist comes on board, we will show hearing test like you see on the video right now. You see the cochlea off to the side there, the yellow looking structure, and you see the ossicles or the auditory ossicles, and that stimulates what's going on with the cochlea. So the auditory ossicles, for those of you that have been following and that know, that is in the middle ear. It's in the middle ear. So we're going to be talking about the inner ear today. So what you see is the cochlea, the gray looking apparatus there with the yellow, looks like ropes coming off of there. That's the acoustic nerve and the vestibular nerve. Those of you that have been following, again, there we have a great video on vertigo. So those of you that suffer from vertigo, you may want to go watch that. You can learn a few things from that. So asymmetric hearing loss is what you see in this audio. Remember, red represents the right ear. Blue represents the left ear. So you will have blue circles, or you will have blue squares or X's for the left ear. The half squares that you see next to the boxes, the whole squares, that indicates the nerve. That indicates the nerve. The half triangles that you see next to the circles, that indicates the right nerve. So the half triangle red is the right nerve. The half box blue is the left nerve. So when you see the left ear and the right ear are separated like they are here, you will notice that anything above 25 decibels, or where the 20 line is, midway of that, anything above that is normal. So if it's in the gray area there, it's normal hearing. You can see that the left ear is completely out of that gray area. And there is a gap between the left ear and the right ear. Because of that, that would be something called asymmetric hearing loss. And we would want to make sure that there's not a growth called an acoustic neuroma. An acoustic neuroma or a vestibular schwannoma. Both of those are the same thing. They are growths on the nerve. All right. So that's a little gee whiz information. We got July the 4th coming up. So those of you who follow me on this channel, you can always go to the family reunions and the 4th of July cookouts and show off for everybody by telling them that you understand asymmetric hearing loss and that it's caused by an acoustic neuroma. All right, so here's the agenda today. We're going to talk about the overview of nerve hearing loss. Today is about nerve hearing loss because it is in the inner ear affecting the cochlea. You remember sound waves go through, and we're going to show a little video about how the ear actually hears sound. Causes of sensorineural hearing loss we'll talk about. And we're going to talk about signs and symptoms, diagnoses, and treatment and management. Alrighty. Types of hearing loss. There's 3. We talked about it. Last week was conductive hearing loss. This week we're talking about sensorineural hearing loss. Sensorineural hearing loss results from damage to the inner ear or the acoustic or the auditory nerve impacting the sound wave process. We're going to talk about sound wave process. We're going to look at a little video, and then mixed hearing loss is both of them. We already talked about that. So what's the difference between sensorineural hearing loss versus conductive hearing loss? Now, I know all my people that were watching last week, and boy, did we got about 10 to 12,000 people that watch. So I know you already know the answers, but there's another, hopefully 10 to 12,000 that have not heard anything about it. So hopefully we can get all of you all together to watch over the week, and we'll knock that number up to 24,000. I'm excited that you all are listening. So sensorineural hearing loss, that is essentially nerve hearing loss, and it stems from damages because of loud noises. It can be stemmed from infections where you get something called sudden neural hearing loss. We need to talk about that. I'm going to give you guys some important pointers about that sudden neural hearing loss. It often leads to challenges with understanding speech, establishing, and that's established from that noise. Now, conductive hearing loss it occurs in the middle ear, and most of the time that's from fluid. It could be a hole in the eardrum. It could be excessive wax. It actually has to be a whole lot of wax in the ear. And we'll talk about how we maintain the ear. And that's usually fixed with medical or surgical intervention. One of the reasons why little kids have tubes is because of fluid in the middle ear. So little kids will get surgery and have tubes in the ears, but grandma and grandpa get hearing aids. All right. So what's the prevalence and the demographics for sensorineural hearing loss? Well, I'm glad you asked me. The age group is mostly in older adults. That is not to say that young children can't have sensorineural hearing loss. Young children can have something called congenital, or things that they are born with, damages to the cochlea or the nerves. And if that's the case, then they would have sensorineural hearing loss. But the majority of patients that have sensorineural hearing loss are adults. And they are affected more because over time, especially if you have jobs like being a truck driver, working in a factory, working in construction, musicians, anything that works around a lot of loud noise. Oh, air traffic control people, those people, if you don't wear the hearing protection that you are given by your job, you can suffer from this. Gender impact, it's pretty much similar, both males and females. And genetic predispositions, there are some families that hearing loss runs in, sensorineural hearing loss, and that would be something from the genes. and you would get genetic testing for that. Okay. So, what are some of the genetic factors? You can have congenital. Well, I tell you what we're going to do. I want to go back and I want to show you. We're going to go back and we're going to do a little video. I want the video to show because it's going to.
When a sound enters your ear and hits the eardrum, it causes it to vibrate. These vibrations travel through this little hammer-like bone, which makes the sound louder. Then they reach a snail-shaped, fluid-filled organ with thousands of microscopic hairs. The vibrations cause the fluid in this organ to move around, and as it moves, the tiny hairs convert the motion into electrical signals. These signals are sent to the brain through a nerve, where finally they're interpreted into sounds.
All right, I wanted to give some credit out to Zach D. Films. He creates a lot of the animation videos, and so I wanted to give him credit for doing this video for us. All righty. Let's go back to our slides. Now we're going to talk about the genetic factors. So congenital hearing loss, like I said, it can be a problem within the genes, and it's really something that will show up in childhood. So you can detect it later on in birth. It may not. So now I can't remember the years when they started it, but they have started testing children, young children at birth to check for hearing loss. If you pass at birth, then that's your first baseline, so that when children start having hearing loss issues later on in life, mostly because of middle ear issues, but we would be able to look back at that and compare it if there is hearing loss detected later on in life. So the impact can be inherited. Now, there are medical conditions that can occur that affect it, and that is, one is diabetes, and that's because there's an increased risk to the sensorineural hearing loss system, the inner ear and the nerves, because of circulation. Another issue for African Americans and those born in Mediterranean areas is sickle cell. Sickle cell can cause sensorineural hearing loss. It's not a big issue, but if there is blockage of a blood supply to the nerve, that can be a problem. Strokes can be a problem and cause hearing loss. Even we found out during the COVID era, when it was in full bloom in the 2020 and 2021, there were a lot of people that were having some sensorineural hearing loss issues because COVID had affected the acoustic nerve. Ototoxic medications. Ototoxic medications are those medications which can affect drugs that can affect the inner ear and the acoustic nerve and cause damage to it. Some of those are antibiotics, and one of the main antibiotics is aminoglycosides. Aminoglycosides. Now, aminoglycosides are a particular type of antibiotic. One common one that most people know about is neomycin polymyxin, or they call it cortisporin. Neomycin, polymyxin, or cortisporin. Now, you need to let your doctor know. Most times, if it's your regular doctor or regular pediatrician that sees your child all the time, they know that they have tubes in the ear. But an urgent care person may not know. And if they decide to give your child an antibiotic drop, do not, I repeat, do not let them give your child neomycin, polymyxin, or the cortisporin. It's cheap, it's very inexpensive. However, it is damaging to the inner ear. So they may have discharge and stuff coming out of the ear. If the eardrum is ruptured and there's that problem, you don't want to give them neomycin polymyxin because it's an aminoglycoside. If it gets down into the ear canal, into the middle ear, and it goes to the cochlea or in that inner ear, then it can cause damage, especially over time, if you do this for 10 days or greater. So, neomycin polymyxin is not to be used in a child that has tubes or in an adult that has tubes, because you would have conductive hearing loss, but you would end up having sensorineural hearing loss if that happens. Gentamicin drops, tobramycin drops, those are not Tobradex, gentamicin, those are not medications to use when you have tubes in your ear, because you now have an opening to the middle ear that goes directly to the inner ear. So most providers should know this. It's on your medical test. But if they don't know, if they haven't, they don't know your history, you now know for watching Body and Balance. Don't allow that to happen. Okay, aspirin. Aspirin, if you look at the small fine print on a bottle of aspirin, it says that it can cause tinnitus. Well, it's causing tinnitus because if you have high dose aspirin for a long enough time, and that's the same with high dose NSAIDs, those things for inflammation, i.e. Motrin, Aleve, naproxen, Goody powder, aspirin, those things can cause damage to the inner ear. Now, if you have to have chemo, one of the reasons that when a person has chemo, they do hearing tests quite often, that's to make sure that there's no damage to the high frequency portion of the ear, because those medications can cause damage. Along with radiation. Radiation can cause damage. Gamma rays cause damage. If they use a gamma knife for a brain tumor or something like that, you can lose your hearing. Now, loud noise exposure. Any loud noise exposure for prolonged periods of time. Well, how loud would it have to be? Well, it would have to be over 85 decibels. Now, I don't know if any of you remember when you were younger and you got these great seats at a wonderful concert, say a Prince concert. I wasn't saved all my life. So I'm saying you're sitting there in the front row and you're just getting inundated with this loud noise in your ear for 3 hours, 2 hours. That's going to be a problem. If you find yourself, young people, middle-aged people, chronologically matured people, if you find yourself having tinnitus or ringing in your ear for hours and hours, maybe even days after going to a concert or being around a lot of loud noise, That's because you've had too much noise over that 85 decibels that has stimulated the nerves in that cochlea. So when you become chronologically matured, that's called presbycusis. Presbycusis. Presbycusis is when you have older age and the function of your body, just like the rest of your body, just like your eyes don't work as well as they did when you were younger and you have to have bifocals. That's what happens. The nerves in the inner ear don't work as well. Infections. Now, let's talk about infections because meningitis is an infection. COVID is a type of infection that can affect the inner ear. That is the cochlea or the nerve. You can get a viral infection that will cause sudden hearing loss. Now, let me tell you, please pay attention to this. If it's one day, everything's fine and you can hear perfectly normal, and you wake up and your ear feels like there's a finger stuck in it or is stuffy, and you just can't hear out of that ear, and you go to your regular doctor, they look in your ear and they say, well, I don't really see anything in there. Then you ask them, if you have the type of insurance that you need a referral, then you need to ask your doctor. You need to demand from your doctor. You need to really, really encourage your doctor to send you to your friendly ENT or head and neck specialist, because you could have something called sensorineural hearing loss. If your doctor doesn't give you a referral to ENT, then at least on your own, I'm giving you information that you need to save your hearing. Go to an audiologist. You can go to any audiologist. There are freestanding audiology groups that will see you, and they will do a hearing test. If there's a difference, like I showed you at the beginning, I'm going to even go back because this is very important. See the difference between the left and the right ear? That can be sudden neural hearing loss. You wake up and you can't hear, you need to go to the doctor. Let me tell you, you have 30 days to 45 days, and 45 days is pushing it. You really have 30 days to get treatment. Treatment is high dose steroids. High dose steroids to try to take the inflammation from around the cochlea, that gray area, and the yellow ropes. You have 30 days to get on some high dose steroids or to have an injection in the ear to try to get your hearing back. If you do not do that, you could end up losing your hearing. So sudden neural hearing loss. One day you have hearing, the next day you wake up, you don't have hearing, or in the morning you have hearing, and then in the afternoon, just all of a sudden after lunch, you can't hear out of your ear. That's something serious. You need to call a ENT or head and neck group and be seen. You need to see an audiologist. Talk to your doctor. Most of the time, they will give you an antibiotic, but that's not what necessarily what's going to help. You need those steroids to get the inflammation from around that nerve. I hope I made this and stressed this enough, because so many people lose their hearing because they wait. By the time they come to the ENT provider, it's like 2 and 3 months out. If you're 2 or 3 months out, those medications, that prednisone is not going to help. That steroid injection inside the ear is not going to help. And so now you've lost your hearing for good. Now, what are some of the common things that occur with sensorineural hearing loss, well, it's difficult to hear. And so if you are sitting, most of the time it's high frequency hearing loss, the high frequency hearing loss where you're like at 4K, 8K, that frequency range is going to be hard. You lose that. What that does is it makes conversations hard. So when husbands, if you're out in the garage and you have your wife in the kitchen with the dishwasher going and you're out there doing something and she's yelling for you to go to Walmart and pick up 50 of whatever it is she wants. You go and when you come back, you bring 60. Well, she says, what did you bring? I said, just bring 50, not 60. Well, and sound the same to you because of the high frequency hearing loss. Your wife may say that, would you like some tea so you guys can sit down and watch a movie together? And you say, because you guys had chicken and rice and peas, no, I don't want any more of those peas. And she's talking about, what are you talking about? That's not what I said. I asked you, did you want some raspberry tea? The thing is, t and p sound the same to you because of the high frequency hearing loss. If there's a group of people and everybody's talking, your whole family's talking, you want to get in the conversation, but you don't understand what's going on. And all of a sudden, they're talking about they were going to go out on a boat. And maybe somebody in the group, your nephew or something, says, man, I got a sore throat. You know he didn't say sore boat because boats aren't sore. So you're using context clues to figure out what people are saying. If you are having those kind of problems, you need to see an audiologist and you need to come and see ear, nose, and throat. Muffled hearing. Muffled hearing is when people usually sound like Charlie Brown teacher. It sounds like that to you. So you need to see someone and get a hearing test done. Tinnitus, that's the ringing in the ear. We're going to have a session on that, so I'm not going to spend a lot of time on it, but it is a sign and a symptom of hearing loss, sensory neural hearing loss, not so much conductive hearing loss. All right, so we're going to talk about hearing tests, and I'm going to have an audiologist coming on here. We'll talk about the hearing test, but right ear is red, left ear is blue. Now, when we're talking about hearing tests, you can have different types of either medical or surgical treatment, taking care of it. Now, medical treatment is not necessarily medicine. We're talking about hearing aids. So outside hearing devices. Now, if your hearing loss is in the mild to mild moderate range, you may be able to get away with the $299 hearing aids with nano or hearing MD, the ones that you can get over the counter or online. You probably could get away with those if it's just mild to moderate, because you just need something to amplify sound so you can hear better, hear clearly. But if you have greater than mild to moderate, don't waste $300 on that. You're going to have to get hearing aids that the hearing aids are so specialized now. They can take, if you have lost high frequency, they can take and make that a bass, and then you can hear sounds better. It's really cool. You learn more about that when the audiologist is here. But that's the medical treatment for it. And then there's surgical. Now, the young child that's sitting there that has on the apparatus in the skull and on the ear, that's called a cochlear, implant, a cochlear implant. So you have to do surgery to have that implanted. They drill into the skull and place that, but it goes through to the nerves that I showed you on the cochlea to stimulate that cochlea to experience sound. All right. So the impact on your daily life is there's challenges when you're in social groups. If you can't hear, now the thing with this is studies are starting to show that people that have problems with hearing end up having an accelerated push toward dementia. There are studies that are showing that and proving this. Well, people will start to pull away from groups. It's no longer fun to be at the family reunion. It's no longer fun to be at the picnics. It's no longer fun to go out with the guys when every time you're having to ask, and you're laughing at stuff that's not funny, you're laughing at the wrong thing, or you're having to lean over to somebody that you kind of trust and say, hey, what'd they say? What'd they say? Well, after a while, people pick up on that. Then people start making jokes and, oh, you need a hearing aid. I'm not going to tell you anymore. You're missing too much stuff. You need to do this. You need to, well, it gets annoying to you. So you move away from interaction. And as that happens, that tends to affect a person's ability to interact. It's kind of like you use it or lose it. And so if you have hearing loss at a certain, where we're going to talk about this with the audiologist, when it drops below 70, when it drops below 50, it's very difficult for a hearing aid to work. It sounds like, for those of you who remember when you got ready to put on your 33 or your 45 record, it would go before your song came on. Doom, 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 doom. I've got sunshine. Oh, I'm sorry. I got carried away. But anyway, work performance can get affected if you are not listening to your boss and they think that you're ignoring them, you are being insubordinate and that kind of thing, or you're missing things that are instructions that you're supposed to do. It becomes a problem. And so you have to get a hearing test so that you can prove, please don't fire me, I couldn't hear you. All right, because at that point in time, now it's a work disability thing and they can work with you. Now, you want to be sure that your hearing loss doesn't lead you to a lot of isolation. We talked about that just a few minutes ago and how it is linked to dementia. So I want to wrap up pretty quickly because I don't like to hold you all on here too long, just so you can get the information. So in conclusion, I want you to understand hearing loss from sensorineural hearing loss standpoint. It is complicated condition because it affects nerves. And it is difficult because once that damage is done, it's done. It's not like if you have a damaged eardrum, a ruptured eardrum, it'll heal up, it'll close up. And you want it to close as much as possible because after that, you can usually put a patch on it. If there's something wrong with those bones in the middle ear, the ossicles, then you could do surgery on those and replace them, and you don't even have to have a hearing aid. That could restore most of your hearing. If it's a cholesteatoma, that growth that I talked to you about in the middle ear, you can always do surgery and remove that, and then the hearing is restored. But if you have sensorineural hearing loss because you listen to that boombox in the 80s next to your head and it messed your hearing up, if you went to concerts constantly and you let it blow out your ear, if you were in the Air Force or the Navy and you worked and they gave you head protection or hearing protection and you chose to put one ear out and leave the other one in, covered up the side so that they could see the one that was on there like you had them both on, and you damaged your hearing, that's going to be a problem because it's damaged, it's gone. And sudden neural hearing loss, please remember, go see someone as soon as you recognize that you cannot hear. You've only got 30 to 45 days to get that taken care of. Now, there's increasing awareness of causes of hearing loss, and timely intervention is important. That has to do with that sensorineural hearing loss. It also has to do with you not losing more hearing. So treatment options are hearing aids, hearing devices, surgical cochlear implants. Next week, we're going to have a small discussion. We're going to have a small discussion on tinnitus. We will be talking about tinnitus or ringing in the ear. That's what we're going to do next week, is talk about tinnitus. So I look forward to you all liking and sharing on YouTube. I definitely look forward to you all going to my Facebook page for Body in Balance. Body in, the letter N, balance, for my Facebook page. You'll find me, and if it's not Body in Balance, it may be Body in Balance 25, Body in Balance 25, and you'll find me on Facebook. Please make sure that you follow me on Body in Balance, that you like and share, that you tell everyone about the great information and the tips that you're getting. These are things you would get in pamphlets and things like that from your provider, but you're getting it right here, hot off the press, here at Body in Balance. I will see you all next week. Hopefully, your horizons have been enlightening. Yep.